So good evening, everybody. It is day 2 of vaccine week, and happy to be here as always. My name is Manuel Castañeda, Director of Community Health at New Brunswick Tomorrow. And unfortunately, my partner in crime, my co-host, Mariam Merced from Robert Wood Johnson University Hospital couldn't be with us today due to an emergency situation, but she will be with us tomorrow. So Dr. Brug, before I introduce you, I apologize for Mariam sends her apologies for not being able to be here, but she knows that you're going to be excellent. I know you're going to be excellent. And so today we do have Dr. Brug. Before I introduce her, just letting you know that we'll be discussing vaccines for the pregnant, right? We'll also be discussing vaccines for those that are in postpartum. And we'll be talking about the vaccines and fertility issues. You know, we've heard a lot from the community, you know, with concerns that, you know, I don't want to take this because I think it could affect mine or my children's ability to have children after the fact. And so we'll be discussing those points, as well as we'll have a guest star, Dr. Hussain, come in and talk to us about long-term COVID effects. And what I mean by long-term COVID effects is symptoms that you continue to have after you recover from COVID. So some people, I can even speak for myself, I had COVID early on in September of last year. And after I pretty much, was okay, I still had to deal with chronic fatigue for almost 3 months before that went away, right? And I know that people are experiencing that and other things. And so we'll be discussing that a little further on today too. But I think I've left people in suspense long enough. And so I definitely want to introduce our guest speaker today, Dr. Pamela Brug, faculty and practicing physician at the Rutgers Robert Wood Johnson Medical School, Department of OBGYN. So Dr. Brug, thank you so much, first of all, for agreeing to come talk to our residents here today about these topics. Thank you.
Thank you so much for having me, and I look forward to our conversation about a very important topic.
Absolutely. And I definitely would be remiss if I didn't mention a great organization that you're affiliated with, which is the New Jersey Black Women Physicians Association. And definitely want to recognize the great work that you and your organization have done with respects to helping setting up clinics to get vaccines here in the city for our community, as well as testing sites. So thank you for your continued support in our community. We really do appreciate it.
Thank you. And thank you for helping us.
Absolutely. And so let's jump into it, right? One of the things that we've heard a lot is concerns of those that are pregnant or considering getting pregnant, right? With respects to getting the vaccines. They're like, a lot of people I've talked to, I even got family members that tell me, look, we're in the process of getting pregnant. Some of them are pregnant. We're going to hold off on the vaccine because, we think that's going to be dangerous. You shouldn't do that. Is that the case, Dr. Brug? Or is it something different?
No, actually, it is totally different. Basically, the vaccine is the protector for both mother and baby, because we know that pregnant women, if they do get COVID, have a higher risk of actually getting the moderate or the severe form of COVID. And that unfortunately makes you can put you in the hospital, can put you unfortunately in the intensive care unit. And that could mean that you would need a respirator, a breathing machine to help you to breathe. And unfortunately, even in New Jersey, we've had pregnant women die from COVID. And the risk for that to happen is higher for pregnant women than women that are not pregnant. And so therefore, the one protector you have, we do not have medicines that can get rid of the virus. What we have is the vaccine to help prevent you from getting it, or at least not getting the moderate or to the severe forms of the infection.
I guess another question that we get a lot is, so what's the current data? I think a lot of the concerns that we've heard from, like I said, either those wanting to get pregnant or are pregnant, that this vaccine is new. We don't know how it'll affect me. we don't know how it will affect the baby, right? So my question to you is, are the vaccines safe for mom? And then are the vaccines safe for baby?
Correct. Yeah, so we have information now, um, both here from the United States and in Europe, about hundreds of thousands of pregnant persons actually being vaccinated. And we have not seen any bad effects to the babies, number one. And the side effects that the mothers have are the side effects the same as you and I would because we're not pregnant, right? So, fever, soreness at the injection site, muscle aches, cramps, nausea, vomiting, all are possible because of the vaccine. I think it's very important. I think people always say, oh, well, we don't know enough. This vaccine is going to change my DNA. That's a common concern that I always hear, right? And the vaccine, the way it's made, does not go into the part of the cells, which we call the nucleus, where the DNA is. It sits outside of the nucleus to help build up your immune system. And it actually leaves that, what we call the cytoplasm, quickly. It isn't there for months and years on. So I think people have to understand that it is something that, yes, it seems like it is new, but the history and the data behind how this vaccine was created, especially the Pfizer and Moderna, is decades old. We just didn't use it for COVID-19 is named 19 because we detected in 2019. But it was used for another virus called the Ebola virus.
And I think you bring up a great point, right? Thank you for clearing that up, because a lot of people have expressed that concern, right? That they feel that this is a newly developed vaccine, but the reality is that these vaccines have been around or been developed for the last 10 years, right? And so even though it's being applied to a new disease, the technology itself is not new, and it's tested,
Correct.
right? And I think that's important. I think I just want to kind of
I also want to say
yeah.
what else is important is that the safety steps were not missed, and they also are still happening, right? So the FDA, there's safety steps. So they are watching what is happening with the vaccines as people are getting vaccinated. But before, when they were doing the studies, now a year and a half ago, they were actually going through the same exact safety steps, even though this was an emergency to get the vaccine to the public.
And just to reiterate, I just want to make sure, because I know people kind of look obviously at pregnancies as the 3 trimesters, right?
Yeah.
At no point is that unsafe for a pregnant woman, a pregnant person, correct?
Correct. There hasn't, one of the things that's always asked, does it cause a miscarriage? No, it does not. Will it cause my baby to die inside of me? No, it does not. Will it cause me to go into preterm labor? No, it does not, right? Meaning that the baby's born before 9 months. It does not do that. But you know what does do that is COVID, the infection, right? So we have seen miscarriages, unfortunately, babies dying inside of the uterus, when the mother is infected. We've also seen, unfortunately, a higher rate of preterm deliveries in women that have the COVID infection. And then you have to know that if your baby's born early, the baby can have problems breathing, holding its temperature, feeding. All those things can happen when a baby's born early, before 39 weeks.
Wow. So yeah, you're actually proving the point against that, right? That it's actually more important to get the vaccine because the COVID itself, if you get sick, can affect the baby much more than anything that they can think that, even though there's nothing proven on the vaccine, it's a lot more dangerous to have a pregnant woman get COVID and be, with respects to the baby.
Definitely.
And just another point, you mentioned side effects. These are the same side effects that every vaccine to a certain extent goes through, right? This is not something unique to COVID vaccines. Is that a fair statement?
Some of them are, right? Every vaccine, because it depends on how it's made and what disease it's trying to fight, can have different side effects. But the most common ones, the pain in at the injection site, sometimes the fever, the muscle aches, those are common side effects of most vaccines that we get. And pregnant women are encouraged, and it's discussed during their pregnancy to get now not only the COVID, but also the flu vaccine and the DTaP vaccine, right? So there are other vaccines that we do give during pregnancy.
Yeah. If I can go back to one of the major things that we've heard are fertility concerns, right? We mentioned a bit about those wanting to get pregnant, right, and being afraid, but we've got it on the other side too of parents being afraid to get their kids vaccinated, especially their young daughters, right, for fear that that's going to mess with their reproductive systems, right? That's going to issue that they'll in the end maybe having issues with fertility. Is there any truth to that?
There is no truth to that. So, couple of things. One is, remember, the vaccine does not affect your DNA, right? It is just to build up your immune system. So if you get the virus, you can fight it and not get severe symptoms. Okay. We do not. One is the person, if you're saying, oh, maybe 2 years, 3 years down the line, oh, I want to get pregnant, right? There is nothing that shows that having this vaccine will cause you to not be able to have a baby, both on the female side and on the male side. And then again, remembering now you're pregnant, you have a baby boy or girl, the concern is, well, my baby will not develop the way it should. And there's nothing, the technology that's behind the way the vaccine was made, it doesn't, because it doesn't affect the DNA. So it doesn't affect the things that make you a male or female or let you go to puberty, right? Because the common thing is, oh, will it affect a young girl's period, right? So even so, my baby girl, you know, who I'm now giving the vaccine to, or the girl that I may be carrying, and it does not. Okay,
Yep.
and so it's very important to keep asking questions so that you feel comfortable that your questions are answered and you understand what's been said.
That's great. Thank you. I think you really hit the points. I have one final question. It's a little bit off topic, but I think it's important, right? And I think it's important to hear from people from our community. And this is about the vaccines just in general. We hear a lot from marginalized communities, the Latino community, the African American community, that historically and understandably so, there's a distrust of the government, right? If we go back to Tuskegee and the atrocities that happened there, we recognize them, we learn from them. But a lot of people that either were around for that or recognize that, and there's just a general mistrust amongst our communities with government mandated anything or government sponsored vaccines, right?
Mhm.
Does that hold true with the COVID vaccine? You and I'm asking you as an African American physician, right? How would you address someone, let's say who comes to you who's African American themselves, raising these concerns to you?
correct. Well, one of them is for you to say, I get you, right?
Right.
I have to be honest, when the vaccines were, because I'm an OBGYN, I'm not an immunologist, etc. It's not my specialty. I myself said, let me step back. And of course, being a doctor in my family, everyone was looking at me for the answers, right? And I had to step back and I was like, they're not going to push that on me as fast as they wanted to. So I had to go and do my research, right? I read the studies. I read how many Blacks and Hispanics were actually in the studies to make sure there was no differences in their side effects or in their outcomes. And I found that there wasn't. And that they actually, studies, some of the studies actually tried to weigh it so that more Blacks and more Hispanics were in some of the studies in order to make sure that there were no differences and to demonstrate that this was safe for everyone, right? So I say to everyone, please get your questions answered. I think that's the most important thing. I get it 100%. The mistrust and the distrust and the hesitancy. But I say, look around, ask people that you trust who look like you to get information from them if you can. And then also, read, pick up, you can go on the CDC, you can go on the New Jersey Department of Health and get information for yourself. And so that you are getting the information for yourself and not listening to things that a lot of what is in social media is not true. And it's actually affecting our communities, which have been hit the hardest, if you, in percentage wise, right, from this, both in hospitalization and in deaths. And we, because of historical reasons and hesitancy and not liking this whole new vaccine idea, we have not gotten vaccinated at the rate. So pregnant women are low. So they're in the low 50s, about 51%. But Hispanic and Blacks are at about the low 30s. However, when you look at who is affected, right, it is Hispanic, especially in New Jersey, Hispanic women, pregnant, and then, Blacks. So I think it's important that you get the information, get your questions answered, speak to people that you are comfortable and you trust so that you can make an informed decision for yourself and your family.
Yeah, I appreciate that. I definitely want to sum up some major points that you brought up that I think are important stressing. Number one is get the information, right? But get the information from accurate sources, right? You mentioned the CDC, you mentioned the Department of Health, your own physician, right? Talk to your
Yes,
doctors, talk to doctors. This is not the type of disease that you just want to get advice from your aunt or your uncle or your neighbor. To your point, social media, you want to make sure that you're getting the right information. So you need to go to the people that know, right? People like yourself, which I think is very important, that other people hear you as as a Black doctor, right? Saying, look, you should get this vaccine, right? That it's important to get this vaccine. And so I want to thank you for taking this time with us, because I think it's very important for our community here, people that look like they are from our community, right?
correct.
And that we are promoting the use of the vaccine because the science is telling us that this is the best way to go right now.
Correct.
Yeah.
Thank you so much for having me here and actually for this whole week. I think it's so important for our communities to have these opportunities where they can get the information.
Thank you, Dr. Brug. And so now covering our next topic for this day, we said that we were going to talk about long COVID effects and resources. And so happy to introduce Dr. Hussain. Mariam, I'll let you do the formal introduction, but thank you for your time. But we wanted to ask you questions around long-term COVID effects, what that means and what people can do if they're experiencing that. But let me stop there. And Mariam, why don't you officially introduce Dr. Hussain to everybody listening to us?
So thank you again, Manuel, and it's my pleasure to introduce Sabiha Hussain, which is a physician here with us at the Rutgers Robert Wood Johnson Medical School. She's an associate professor of medicine in the Division of Pulmonary and Critical Care, and has done a lot of work around social determinants of health with our patients here, and also is running one of those first post-COVID clinics. And we would love to hear from all the good things that are happening there and all the services that the patients are receiving here at Robert Wood. Thank you, Dr. Hussain, for being here.
Yeah. So maybe if you could start by letting us know what is long-term effects. I think people don't necessarily understand what that means. So maybe if you can, you can explain what that is, and then we'll take it from there.
Sure. So, long haulers, that we call them now, like post-COVID. So these are individuals who've had COVID, had the COVID infection, and despite sort of getting through this acute infection, approximately we're making a definition that individuals who 1 month post-acute infection are still having symptoms. So symptoms are sort of varied. A lot of patients are having issues with shortness of breath. They may be having a lot of brain fog, meaning they're having short-term memory loss. They'll have joint pains, loss of smell or taste, dizziness. So a lot of varied symptoms are occurring in these patients who've had COVID, and it's sort of persisting. And so we knew from the beginning that these patients were going to have to be dealt with. One, because just the sheer number of patients who were affected with COVID, and not being able to address these issues in a meaningful way would not only sort of debilitate our communities, because now they're not going to work, they're not able to help with their kids, all those kinds of things that would have long-term impact. So what we decided is we really need to develop a multidisciplinary approach to care. So the post-COVID recovery program here at Robert Wood Johnson University Hospital is one where we make sure that every patient is seen by not just me as a physician, but is also seen by a social worker, is seen by a nutritionist, a physical therapist, a neurologist to look at the neurocognitive things. They basically have a navigator to try to help them figure out and navigate some of the testing that we need to do. There is a lot that came out of the United Kingdom as well as from France. They were somewhat, ahead of us in this whole pandemic, and they recommended that every patient who had COVID, but especially those patients who had long-term symptoms, which should be followed out for 2 years. So we are following out every patient. We do have them get CAT scans of the chest, breathing tests, but also other labs to look at, what's happening in terms of inflammation. We do what's called the social determinants of health screen as well on every patient, only because we know that there are things that affect their health that's outside of just their breathing and stuff, right? So we make sure that they have access to medication, they have access to resources. And so these kinds of, and we're just one of the post-COVID recovery programs that are available. And so we would say that if you did have COVID and you're having long-term sort of consequences or symptoms, that please reach out to your primary care doctor, but also, maybe search for resources that are available, and sort of go from there.
You're muted.
Yeah, I noticed. Thank you. And just for the for our people listening in, I understand you saying that obviously talk to your primary care physician if you're feeling this way, that there are other post-COVID clinics, but is there direct information you can give on your clinic so that if they wanted to reach you?
Sure, sure. I mean, we do have our phone number here is, the pulmonary phone number is like 732-235-7840. And you can always share that in the chat. We have a social worker who works with us, Carol Shu, who's excellent. And we can always send you, we have a group email, and that email address is a way for anyone to contact the group to be able to schedule. And I'll make that available for you guys so you can post it to your listeners, and so they'll be able to have access to be able to be part of the program. We do ask that people fill out surveys when they're in the program, only because we want to see how you're progressing in terms of your symptoms, also trying to see if there's new symptoms that are coming, and even just, in the past year, how I've been taking care of these patients, there definitely has been an evolution of symptoms. Like initially patients would have lots of shortness of breath, and now there's a lot of pain that is happening in a lot of our patients, unfortunately. There's a lot of short-term memory loss, and connecting people to neurocognitive resources is very important. And as you can imagine, there's also caregiver issues, right? So people who are actually taking care of these patients who've had post-COVID syndrome have issues too. And so we have programs for caregivers as well, so that they can be connected, they can get, psychological help. And we have an advisory committee so that people can come in and sit on those advisory committees so they can help us better develop the program and really meet the needs of the community. And make sure that the patients are getting what they need.
I really like that this is a comprehensive model, because many people will think that I just lost my taste, right? But to lose the taste of the coffee that you drink every day can be depressing.
Yeah.
And then that will, you end up in a different place, right? Like you lose that sensitivity to the food that you always like, to the cultural, preferences that you have, and that can take you to a negative place, right? So be able to have a comprehensive way of looking at these things will be great. That a social worker say, well, maybe you need to go and talk to someone, right, about what's happening to you. So I really like that approach. And I see many people going through this and not relating it to their COVID cases, right, or that they had COVID in the past.
Exactly. I completely agree.
Well, that was great, and I think it's definitely worth mentioning. I think a lot of people have been concerned, and Mariam, you bring up a great point that concern can lead to other issues, right? So it's better to deal with it before things get worse, right? So
and I mean, we've seen it too, like a lot of this stress, like on marriages, it's a lot. It can becoming very overwhelming, and it's acute. A lot of these people, we have like a lot of college students who were runners, they were athletes, and now they can hardly walk to the bathroom. So it's very, very, and it's something that you would not have anticipated, that a viral infection will now result in a chronic disease.
Yeah.
So it can be very debilitating and mentally just devastating.
Yeah.
great.
Thank you for all that work. We really appreciate that we have these resources right here in our community.
Yeah.
Absolutely. So thank you. And so we hope that everybody got a lot of information with respects to the vaccines for those that are pregnant and those in postpartum, as well as we've answered, any concerns around fertility, as well as now knowing about long haulers, right? As you say it, with people that are still experiencing some symptoms even after COVID has at least as you say, the acute systems, I can't speak today, the acute symptoms have subsided. And so I think all of this is important information, and we thank you very much. Thank you everybody for joining us. Tomorrow, we're going to be talking vaccines and kids, right? So, you know, we'll be talking and raising the topics of whether you should vaccinate your kids or why you should vaccinate your kids that are 5 to 11, which is the recent, you know, recommendation. And obviously continue with the recommendations of vaccinating youth 12 to 17, right? We'll also be addressing parent concerns because we get it. You know, I'm a parent myself. You know, you want to make sure that whatever you do with your child, that it's being done safely. So we want to at least make sure that you have the accurate information, and we'll be covering kids and vaccines tomorrow. But Dr. Brug, again, thank you so much for being with us today. Miriam will be with us again tomorrow. Again, she apologizes for not being able to make it today, but we made it through. Thank you so much for the information, and good night, everybody.
Good night.